Having your menses is a normal period in our life, but are you really taking care of yourself the way you are supposed to? How many times are you supposed to change your pads? How do you care for your sanitary products? And are all the things you've heard about menstruation actually true or not? Today, we will find out the answers to all these questions and also share practical tips to help ladies and women to stay healthy throughout their period. Hello everyone, and welcome to Health Matters podcast. Here, we share simplified health informations that help you to make informed decisions for yourself and also improve your well-being. I am your host, Miss Inseidu, and throughout this July, we've been discussing menstrual and reproductive health. Last week, we talked about know your cycle, understanding menstruation, and what is normal. Today, we are taking the conversation a step further. We are discussing about menstrual hygiene, facts, myths, and practical tips to do during this period. And to help us understand this great topic, we've been joined on this show by a very special guest. She is in the person of Madam Charlotte Bafo Ewa. She is a municipal public health nurse at Efia Kwesimintim Health Directorate. Madam Charlotte, you are welcome.
Thank you very much.
It's really a great pleasure having you here.
Same here. Thank you, and greetings to your viewers.
We all accept that. So before we delve into today's discussion, I want you to go on our various platforms, share the link, subscribe, comment, and join us. Let's learn together. So on today's episode, let's dive into today's conversation. You're welcome once again.
Thank you very much.
So let's start with the basics. When we talk of menstrual hygiene, what is it about and why is it important?
Okay, thank you. So when we talk of menstrual hygiene, we are talking of menstruating as a woman or a girl, and then hygiene, as we all know, conditions and practices surrounding this menstruation, doing it safely, and then doing it dignified. So you feel dignified when you are menstruating. You are practicing menstruation, doing it safely, and then you are managing it very well. So that is menstrual hygiene. And then you talk of why is it important, and I would say that it's very, very important. Menstruation is very important in a girl or a woman's life. So as a woman or a girl, you need to menstruate. We all need to menstruate in order to in order for us to be a woman or a girl, we need to menstruate so that we'll be able to even reproduce. So you go to a gynecologist, and the first thing they'll ask you, do you menstruate? Or what's your last menstrual period? So it's very, very important for a woman or a girl to menstruate. Yes, so that's how important it is.
Thank you so much for this great explanation. So my next question is, now there are a whole lot of menstrual products on the market. And sometimes choosing the best one for yourself becomes confusing. So my question is, what are some menstrual products and how can a girl or a woman choose the right one for herself?
Okay, so you see, I said menstruation is very important and critical in a woman's life. So for your reproduction to be complete, you need to menstruate. So menstruation, we shouldn't take it that lightly. Make the whole menstruation period dignified and comfortable for a lady. There are several of these products on the market, and we are not here to market or advertise for any particular products. But we have sanitary pads on the market, several of them, so we can mention a whole lot of them. But let's watch out for the FDA approved ones that we can use. So you buy it and then you look for what has been approved. Yes, so we all need to read on it and then get. And then we also have the tampons. We also have the caps. And sometimes people use tissues, which I will not agree with them. I do not. And it's not hygienic. So we say menstrual hygiene. So we use tissues and it's not hygienic. So we know that using tissues, you know, even when you use a tissue to just even wipe your face, yes, you can see some particles left
that's
behind.
true.
Yeah.
That's true.
So use tissues and then you have them leaving particles in your vagina or your external genitalia, which is going to travel and cause infection and bring problems later on for you. So that one is out. Use the sanitary pads, and then also, you know, you are speaking to community people. We have classes of people.
Yes.
So you need to be considerate enough to talk about the thing generally. So we have other less privileged women or girls that you need to consider them. They use clean clothes, clean dry clothes to also do their menstruation, which is not bad. It's also very good, provided you keep that article very well and you can comfortably use the item to menstruate. So we have all kinds of things that we can use for this menstruation. Yes, they are also very good to use, except the papers. Some use the old graphic or papers to menstruate, and then tissues that it's not
Those
hygienic.
ones are out.
But you can use your pad, you can use your tampons, you can use your caps, you can use your old cloth. That is clean, dry, and then you can use that.
Thank you so much. So talking of sanitary pads, I think that one is the most common one that almost every girl, every lady uses. So can you help us demonstrate how we can apply our pads on our pants then? Which pants are even suitable for us to use when applying the pads?
No problem. So we will take them. This one, we have been doing it. We have days, like in May,
Okay.
we have the whole month we do menstrual. It's a week that we should do, like
Okay.
menstrual week celebration. But we have the World Menstrual Month. We have given May for it, and in the Fiankwesi meeting, the whole directorate, the whole municipality, we visit schools and we share pads. And these pads are gotten from philanthropists, NGOs, the district assembly, individuals, organizations. They provide us, we write letters to them, and they give us, they donate pads for these girls. Not forgetting the faith, the religious people, the churches.
Yes.
Yes, so we write to them, and they are so generous to donate pads, boxes of pads. I mean, they do very well to give us. And we go to the schools to give education on menstrual hygiene. We sensitize the girls, and then we teach them how to use the pads, and then we share for them, and they are all happy. We even try to also add the boys. Yes, and they are so happy listening to
Yes, I think this part, our gentlemen should come around.
Yes,
They could also be of help.
They should help us to menstruate.
Yes, it's
we are
true.
in this together.
We do it together.
Yes, we are in this together.
So please, our gentlemen, I hope you are watching.
Yes.
When your partner is unable, the person is going through severe pain, you can be a gentleman, be a lovely husband, and you know. So please come and let's learn it together.
Yes, so you can be a brother, an uncle,
Okay.
a daddy, a husband. You help the woman do it very nicely. So we have our panty, a nice one, of course. So this is our sanitary pad, and this is our tissue. So we advise the ladies that you know you are menstruating, especially the young girls. Yes, so when they are going to school, mommy helps them so that they get their sanitary pad, an extra panty, and then a tissue. Then you keep everything in your poly bag. Then you keep it in your school bag. Okay, so keep it in your school bag. So when you go to the school and then you feel moist, So you don't wait to be named and shamed. So you understand that one, girls. So when you feel wet or moist, you need to visit the washroom, go change up, and feel warm again, feel dry again, and feel comfortable, and have your dignity without shame.
Sure.
So you go there and then you change over. So this is how you are going to put the pad in the pants. So you just turn it, and this is the rough part, okay? So we have this one, I would say maybe the correct part, and this one is the wrong part. So you turn it like this. You
Okay.
have your pad here. So you open up. You see you have a tape. So you just open up. Open up. So before you do everything, we need to wash our hands. So when you are going to change your pads, you wash your hands, or you can use your sanitizer for convenience sake, okay? So you open, and then you can see that we have a shorter portion, and then we have a longer portion. So looking at it,
Can you lift it a bit so our viewers?
okay, so you see, this is the shorter portion and this is the longer portion. So we have two versions of it. And this is our panty. I've turned it. We have the wrong side. But you see, the one that will come in front is this one. What I've turned here will come in front, and the one below will come to your back, your buttocks. Yes, so it's like that. So this is how you turn your pad. Your pad too, the one in front is up, and the one that will come to your buttocks is down. Just like you've done to your panty, okay? So you do it like that. And then you see, I'm just wearing it. So you can just pull this off. We have a sticker too at the back here. So you do it nicely like that.
Okay. Yes, I hope our gentlemen are following
Gentlemen,
very
please
well.
watch so that you help us do it, okay?
Come to our comment section and then come and share your views on that.
So you put it nicely here and there. So you are good to go. And we have the inner sticker too that we need to deal with. So just make sure it fits the panty very well. Then you just press here and then take the inner parts, you put it down. Don't forget your poly bag is also here. So everything, every waste goes into the poly bag, okay?
Okay.
So don't take your pad off here too. Let it be there to take up whatever that is coming.
Okay.
So this one is you changing over. Or after bathing in the house, you are going to put your pad just there. So you turn this one and then just put it at the back here.
Okay.
Then you turn it, and then this one too, you just put it at the back here. So you see it's like that. So you can see that the shorter version is in front, and then it travels with the longer version at the buttocks.
Yes.
Yes, so you have something like that. And you see, we have other people too who are, when you are traveling or you have a heavy flow, they want to use 2 pads, double of them. It's nice. You can use it, not bad. It protects you a lot, and it's fine. So that one too, you can let it overlap, coming to your buttocks, because you can see that that one coming up raises a bit higher. So this one, you can bring it here and let it overlap the one that comes to your buttocks. Let it come, then it will free it and come here. But we have also other brands. The producers have made it in such a way that it's longer. It's longer and it takes the whole panty. So if you can afford that one, it comes with a little cost though. If you can afford that one too, you can use that one and then it will be long enough. But this one too is not bad.
Okay.
So you turn it like that. And then you have your panty with the sanitary pad inside, and you can wear. So you can put this one down, and then you have your tissue. This one is a bulky one, but you can just take 1 or 2 tissues and put it in the poly bag so that you don't have a bulky thing going to the washroom. This one, we want a dignified thing. We don't want something that the boys will be naming and shaming us. So you don't want them to even see you sometimes. So you take off your pad.
Okay.
So it's like this one is after bathing, I came, put on the sanitary pad, and then I'm good to go. But the waste should be in the poly bag. I'll just wrap everything and then go and put it in the bin. If you are on the toilet, in the washroom, you see we have a bin there. So just tie your poly bag with whatever and then put in the bin. When we are in the school, there is no bin in the washroom. Come and put it in the bigger bin where it can be closed. Don't just put it on the floor.
Oh, yes.
If there is no bin where you are in a car, you are in anywhere, come and put it in your bag. So that when you get to where a bin is, you can just put it in a bin. So this is how you are going to also remove your pad after it's been soiled and you want to take it off so that you can wear your panty. So it's like that, it's like you are wearing it. So you just pull it down small, and then when you start pulling it, you see the other sides will pull.
Yes.
So don't stress going to do it so that your hands will be bloody all over. So now you have to hold here, and then hold your panty.
For us, panty. You may then not.
Yo, enti ye pese ye ka tree kakra. Enti no so ye kwa ye be yi nti wo so ano ne saa no. Wo twe a eno a be yi ne ho. Aha, be yi ne ho. Fa won san fofo bebre na ye nsa nye moja ne ade. Esan se a akoye waste. Enti se first na ye bebo ne de na ye clean. Se a no blood ni wo. Aha, nti e kire ne de enye wo ho me nsa e de kire sei no. Blood na enye because sticker wo ho sei. Nti eno no e hyem blood ni wo inside. Enya de a aha no ma ne jelly like sticker. Nti enka wonsa. Nti no bomode asom yi ne to me bend no na ka chechire ho chichire nyina na etare. Aha. Nti e betare kama. Nti e ka chire wo say foul. Pad no wrapper no. Fa share o poly bag nim. Ne fa to. Nti this time no eno na wo de be den. Wo de be wrap. But sorry. Wo tissue wa ha say. Wo tissue no na wo de be paper wo ho. One wa so paper wo vagina no. Ana wo paper wo vulva no baby a blood ni free by no. Wo be paper ansa na wa hye foforo. Okay. So that be ya wo be feel very dry. Yes, so you take your tissue. So fa wo tissue na wo de a wipe kama. Wo wipe wo paper wo ho so a me pa cho. Paper fro wo anim bra wachi. Wo de infection bebre be free wachi wo e de aba wanim. Enti paper free wanim ne fa ko wachi. Sa anye yi a me fa paper biem. Fa tissue foforo. Enti na me di kan ka se fa me nu ana me ensa fa ba konko. Na imom no wasa fa another one. Na wo de aye fa anye mienu because wo de e ba ko no de akọ wachi ewie. Nti sa wo san so e de be ya na che se wo de wachi ne ba wanim. Okay. Infection beba. Wo ye menstruation nso a because the hoye moist na ho na ye nsuo kakra na aye dumpy no infection e travel easily. Yes. It is one keep hygiene ni ya or menstrual hygiene one ni ya bit me a whole lot of infections. Yes. Na a traveler akoye a pelvis na akoye pelvis inflammatory disease PID. Yeah, I can't bro focus here to PID. So please let's do well to keep our menstrual hygiene, the practices along with it very well. So now that you have used your tissue, you also have to keep it.
You wrap it together.
You wrap it together. You get me? Okay. So you have a sticker here. You can do it, and it's very nice. So the poly bag, there's nothing in it now, so you can just put your pad in it. Okay. Then you wrap it. If you have your panties, so we want to do practical things here. Sometimes our panties, we change them and we have the soiled one.
Yes.
If you have the soiled one, then this one, you can keep this one in a bin and then put your panty here.
Okay.
Or you put everything together. If there are no bin, you keep it together, but don't throw them away. Keep it in your bag. And then when you go, you can take off your panty and then you dispose the pad. Nti are to pad ne so achi na no ye pa ocho. Pad no me fan share water closet nim. Na enko flash. Ye kan champion for no ye dey teenage girls or adolescents na wo ko no. Ye pa ocho en fan so toilet nim. Nti say ye ko public toilet na say ye di tuma. Water closet dey won to ye flash them obekwa ko say no. Nti ye pa ocho fato that's been na wo dey si wo dey or the toilet papers tum fatum. iron in the me will be a baby no yeah I saw. So you just put it in. When there is no bin to come and put it in the bigger bin. Make sure it's in the bin and not on the floor. So that is all about how you wear a pad and how you take it off. So I hope we are all conversant now with how we deal with it. Thank you very much.
Thank you so much. I'm sure you are enjoying the way the conversation is going, right? Send in your comments on all our social media platforms. Like, share, and subscribe to our platform as well. And to our dear gentlemen, we hope you've learned a lot today. So please, be helping us. So I'm sure now that we've understood or learned how to apply it, most girls are asking themselves, so how many hours or how long should I keep one pad on before I change it?
Okay, so after changing, please let's try to wash our hands. If most of the schools have the hand washing facilities, if you don't have to, because of COVID now, we are all having as hand sanitizers around. So we can just use our hand sanitizers or we go and do our hand washing so that you see we are talking of hygiene.
Yes.
So we need to keep our hygiene. So your question is
My question was, how many hours or how long should we keep the pad before we change it?
Yes, so we know that we are individuals and unique. So we all need to steady ourselves and know how we flow. So there's no hard and fast rule about changing 2 times a day, 4 times or 10 times a day, depending on our flow. So provided you are having a normal flow, like we started our menses, and you know, as an adolescent, when you have your menarche today, and it will take about 6 months before you menstruate again. Or sometimes even most of them 9 months or in a year before they will go through the normal menstruation. Yes. So for the normal menstruation, you steady and then you know how you flow. And for 6 months, so this is how I flow. I have a heavy flow, I have a lighter flow. So you can see that even for the sanitary parts, some manufacturers have written heavy flow, lighter flow, and all that. So you watch yourself and you buy the one that goes with you. So you, as and when you are wet or you feel moist, you need to change yourself.
Okay.
So I've been changing 6 times. It's normal with me. It's not like I'm bleeding so much. And me too. Oh, I don't bleed so much. I change, but if you don't bleed so much, you don't hold on. Like you've gone to work from 8 o'clock or 9, and then you wait till you go home at bare 5 o'clock before. No. So we want you to be conscious about your changing. Sure. Even if you are flowing, like you are not a heavy flow, you don't have heavy flow, still you need to change because you know that blood and then blood product, when it stays for it, because it's moist, I've always said that because it's moist, it attracts microbes, bacteria, germs, let's say it like that. So when it stays in a place for a longer time, they will try and then misbehave. You know, we have commensals everywhere, but when they get an opportunity, they will give you infections. So at least when you have bled for the first 2 days, when you have bled for 4 to 6 hours, please change yourself. Change. That's the most times. Whether you are soiling or you are not soiling, you try to change so that the odor coming with it, you know, it's normal. You wouldn't have it like you are not menstruating. But it shouldn't be an odor that people will be smelling. But you know, there are changes. So you go and change and feel fresher at a point in time. And then you'll be changing as and when. So we know ourselves. And then we know when and as and when. This one changing every 2 hours. This one is changing every 3 hours. But don't go and then use a pad from morning till evening and then go and change. And then okay, let me hold on that one. Maybe
we'll surely get there. I may ask a question about that. Thank you so much. So as she's saying, we should know ourselves then. After every 4 to 6 hours of bleeding, we try to change ourselves so we will feel refreshed. You know, some people believe that when we are menstruating, we shouldn't do certain activities or we shouldn't live our normal daily life activities. My question is, Are there activities that girls should stop doing it when they are menstruating? Or is it safe for them to continue their normal daily life activities?
You said activities, and my mind just went to bathing because I was going to talk about that one. When I talked of the infections and all this, I said, you see, normal activities, we are used to bathing morning and evening. Sometimes with water issues too, sometimes you bath once and then even the weather. So you don't feel like bathing, especially in the evening or night, and then you go to bed and you are good to go. But when you are menstruating, my dear, please let's try and bath morning and evenings.
Okay.
Like the twice a day, that one, we should do it because of infection and problems that comes up later on in our lives.
Sure.
Because it's where the reproductive organ, it starts from let's note that it's getting to the tubes, the uterus, and that is where we reproduce from. So it's very important that we keep the hygiene very seriously. We bathe, we clean the place out of everything. After every day's work, we have sweats coming on. We have this blood moist mixing together with the commensals. When I talk of commensals, person make say, yeah, well, normal bacteria, baby.
Okay.
Into normal bacteria and so vulva, vagina, no. Aha, into we stay for this long. Normal bacteria, so to me, opportunistic. It can also be opportunist. Say it's onya chance biya or be play rough kakra. Into no, normal commensals times be group here. I was say clean different ones come in, they are fresh day. No protect baby. Ebi wo ye num, ebi wo ya sum, ebi wo ye skin, ebi wo baby nti obi an ne comments anti na e call the next person who ana akwa koye ade ebe ha no. Nti normal ones no wo maka sweat no waka blood ne ho the whole day amesi because the whole paper ene say odi be show ni na ntumi nko say ye ndware anye ye hu ye a ebe ha adwen. Afi nso oka met ne obibi say oh me menstruate dey o say me didi o. We want to say that menstruation or not, if only it's a normal menstruation you are going through, you need to eat your normal food you have been eating, your normal 4-star diet that you have been eating. But during that period, let's drink in more water because we need say fluid is coming out of us and we need fluid. And see no fluids there, you fluids no, and no. But aduane no a normal food a be di no. And one a bedi. Name no to say sugary products. Ye benum ni bebre won't say ye wo wakra no. You can say too much of everything is bad. So everything in moderation. Inti say ye didin po ye be hwe say na ye be didin ti normal foods na ye di na. We don't need any special diet, but let's not forget to say we are in a society. We have our traditional cultural practices, beliefs. We have our churches around with our beliefs there too. We have a whole lot of things. Family even believes that they also cherish. So let's not take sight of those ones too. So they are also there. So we can follow that one. We have beliefs that when we are menstruating, we don't go to the palace, the cheese. So we don't go. There are rivers when you are menstruating, you don't go cross. So those ones there, we will just abstain from those ones. But physical activities like pounding your fufu, cooking, and then doing, we have people doing trainings. We have, how do they even call it? Jogging, running, doing all sorts of things. You can do them. You can do them. Whereas you are not uncomfortable, you can do all of them. But who goes for swimming when you are menstruating? So, there are certain things you will not be comfortable even doing it.
Yes.
And then having sex during menstruation too comes up a lot.
Yes.
So, that one is not forbidden. Because when you know that I talked of reproduction and all those things. So, some people also ovulate during their menstruation. And they need to copulate. They need to have sex with their partners in order for them to achieve pregnancy or fertility. So those people will need to do it. And so it's not an abomination. But if it's for some people, you are not comfortable, and then maybe you get some sorts of pains, or it's forbidden in your traditional culture or your family, you can abstain. There's no, if it's a normal menstruation, you don't have a challenge or a problem with it, because you can have a problem, and today you don't have a heavy menses, tomorrow you start having heavy menses. That one, you have to deal with it. But if it's a normal menses that you are having, you don't have to do anything differently. You just have to do your normal things. Yes.
So with the food, I have been hearing that when you take in egg, okra, it actually stops your bleeding. Personally, for me, I didn't know I might also experience that. So one of these days, I think last 2 months, I was really craving for egg when I was menstruating. Then I just wanted to take it. I took it in, and then later on, I realized that my menses became irregular. So can I say because of this, eating egg is forbidden for me during my menstruation?
Okay, so has it been like that, like previously you've not been experiencing those
Yes,
things?
it was just that period. I'm sure maybe somebody is also experiencing that. Oh, I took egg once,
Okay.
and that very month my menses was.
So if it's a one-stand thing, like you've been menstruating, so looking at your age, you've been menstruating. So maybe if it's a one-stand thing, like is this time that I ate and then I had a heavy menses, or you've studied yourself and you've seen that when you are menstruating and you take egg or milk or any product at all, it gives you heavy flow or it stops it. That one is a different issue.
Okay.
So you see, I started by saying we are individuals.
Yes.
We are unique in our own way. We have different genetics. So things we will respond, our body will respond to things differently and react to things differently. Yes.
Okay.
So you know that food is also medicinal.
Yes.
So there's no scientific base
Sure.
for egg stopping menstruation or giving a
Yes.
heavy flow. We don't have any scientific proof, but you know yourself. They say man know thyself. So if you know yourself that when you menstruate, you've studied that when you take these things, you have an abnormal flow, like it cuts it off or it gives it a lot, and then you are not comfortable, yes, then that is with you. But we can't generalize it and say, oh, when you are menstruating, you eat egg and no. Yes, so you just look at yourself, and then maybe your body makeup does not support you taking a chifwa, then you can just so there's no scientific to prove to that one. Yes.
As I'm saying, it's really a good source of protein, and then iron as well,
Yes,
some vitamins too. So if your body is not actually reacting to it, that either your menses will stop or you bleed too much, it's good to go ahead eating that.
So it's
Thank
not
you
some.
so
There are
much.
some drugs too that are also some inhibits the flow, and if you are on some drugs, maybe you wouldn't have your normal flow. You have a bit heavier, or so your pharmacist or your doctor will let you know that these drugs, or when you even go and read the literature on the drug, you see when you buy drugs there are papers, leaflets inside, so you read and then you can know that, oh, these drugs when you take it's like this. So it's not like you're having an abnormal menstruation, but it's the effects of the medicine and your doctor knows about it. So that one, yes.
Thank you so much. You know, sometimes without realizing, we engage ourselves in some activities that aren't good for us during our menstruation. So my question is, what are some common mistakes that we make when we are menstruating and then it's not really good?
Okay, so I think we've really talked about this one earlier on. Like we said, bathing. So if we try to do a once bathing every day, that's a mistake. So we shouldn't do. And then the tissues that we use, we call them a toilet roll or something. Yeah. So the tissue, I think it's a very big problem. We shouldn't try. Yes, it will get stuck. You can use it to do anything. You see, the uterus, or let me say the womb, as we all call it. So the womb is like it's crying. You see, the eye, it cries. The nose, it cries with mucus. The eye cries with tears. The skin comes up with keratin so that new ones can form. Just like the womb. It's also shedding. It's shed, you know, our nails, it sheds. It grows and then the top one it goes off, then others will come. So that's exactly how the womb also operates. So when it's got the nutrients there, it comes out, and then plus the blood that comes, it sheds, it sheds. So I say a short room, hand. So it comes and gathers, and then the egg that comes and it's not fertilized, everything comes and then it's like menstruation. Then it comes out. So it's not like we say menstruation uchima adibone bi e say ba. No, it's not like adibone. It's nutrients that has stayed. It wasn't used up. There was no baby that month. There was no fertilized egg for it to nurture it. So it came up with your own egg that's no sperm. It came and then it's fertilized it. So they all came and now it's coming out.
Okay.
So we shouldn't treat it like it's filth. That's things that we, so it's filth that is coming.
Yes.
And it's coming and then there's an odor. So we make mistakes and go and take some drugs. You go and take some drugs. We don't want to mention drugs. We are not using drugs here. You take some drugs and it stops the whole thing. So this drug that has stopped the thing when it should be coming out, you see, that's going to give you problems.
Yes.
Because the uterus will continue to share. And then you have blocked it. So what is going to happen?
Blood is
yes, and it's causing infection. The whole thing will cause molds to form, and then you get infection. And then we go about using the tampon, and then we put it hard there. And then the thing, you see, it's supposed to flow. That's why we have the pad or the cloth, the clean cloth there. So you're supposed to be receiving it. Just the blood should come so that the thing will just receive it. It shouldn't go and obstruct it. So if you are obstructing it, you are not allowing it to flow freely, then you're causing problems to yourself. So we need to let it flow. Something that will be there for it to flow. So those are mistakes that we do. And graphics and papers, no way. We shouldn't use papers, graphics, dirty things to do our menstruation, to receive the blood. And then let's keep our parts where it should be kept. Keep it in the pack. It shouldn't be dirty because we are going to use it. That's what we call private parts. Things can travel upwards. We see it like it's a surface thing that is coming. No, the blood is coming from the womb. So it's coming from where, if you don't take care, infections will travel from the lower part and gets to the upper part, and it's going to cause a whole lot of problems for us. And then we shouldn't eat this, we shouldn't eat that. No, everything should be eaten as we're eating it in moderation, and we'll be good to go.
Thank you so much. Let's also not forget to wash our hands after changing our pads. Okay. And if we need help, let's not feel shy to ask. If you are in campus or at work and you are short of any sanitary products and you need to change, don't feel shy. Rather than keeping the old one, try and then change yourself. Thank you so much. So many women worry about odor when menstruating. And is every odor a sign that something is wrong? My question is, what causes that unpleasant odor to come during our menstruation, and when should somebody be concerned about that odor?
Okay. So, odor. So we didn't say bad odor. Or when you said unpleasant, then I became uncomfortable. So, you see, you are there and then there are changes. Okay. So there are changes and then you will smell. There's a smell. But it's not bad. It's not uncomfortable for you or the next person. Okay? So you have that one. Because for the vagina being there, there is an odor. There is a smell there. And it's natural with it. It's natural. It shouldn't be a bad odor. So when you are menstruating and then you smell bad odor or an uncomfortable, unpleasant odor, then it's a problem. Then you have an infection. Then you have a challenge. Then you are not being hygienic enough. You have a problem in there that we need to treat. So with that one, you need to visit your gynecologist, your nurse. You need to go to the health facility to see the clinician to treat you. Because you shouldn't have bad odor. You should have the normal odor. You shouldn't have to smell any bad odor. And ladies, even if it's an adolescent or a teenager, we all know the normal odor of our vagina. You shouldn't have a different odor when you are menstruating.
Okay.
If you are smelling a bad odor or an unpleasant odor during menstruation, it's not normal. So you need to report that one. Or if there are changes with the blood that you are seeing, if it changes, you are menstruating today, and you should see a reddish blood coming, and then it's blackish, please, it's brownish, no, you would have to report. Because when it's getting to the latter part, like you menstruate for 3 days, it's normal for some people. Some people can menstruate for 5 days, 7 days, and it's normal for them. That's why I'm saying you steady yourself for at least 6 months so that you know you're normal. So that when it's getting to the abnormal, you know when to report. So if you are smelling bad odor, you need to report. Because there could be an infection that you need to treat. Yes.
Thank you very much.
And we need to wash ourselves very well. But we shouldn't be douching. You shouldn't be douching. Don't insert your hands in your vagina. Just wash the vulva. Me pacho, me pede me chede. Ye ka che hembesi afune de. Se ororo na se a menstruating poa. Menstruation no na aba. Blood na nyema na nkasa ba. Nti me fa won sa nkɔ hyehyɛ waase de ororo waase no ho yie nti de won sa erkɔ hye. De bi fa won sa nhye ho. Emomu na eguara na di nsu no. Men use strong soap mpo. Obi o se perfume bi opede ode wo horo na ase na wo ma won soap na concoctions. No. Oye ne natural ade. Nti fa nsu keke ade guara ni bi no. Fa men fa soap mpo mfa anye. Fa nsu no fa wo horo waase wo no vulva wo no. Na animu no wahu. Fa nsu no fa wo horo. Na mom fa semina na no nye den no fa guare. Wo nan tetemu na ade no na waasre ho no. Fa ye ne dema. Se ye ko ye gyaye na no so a na ye pa ye ho a te dem ma ye kan no na ye de toilet roll na tissue no ye da paper ye de free enyim ye da afa echi se de free echi bio a mfa mba wa enyim ye wie nso a na ya kai na ya wohoro ye nsa ho kama ono so ye de semina na nsu eno de ekowe gyana no wie a onhia de be use to sanitize o sanitizer no omo onko mfiri won nsa ho be se erutu kwan na enyi bia one de for cho use na ekodu destination na ono na asre nsu na semina nti kai na me mfa ndidi na akodu destination na wo won nsa ho kama ene semina ansa na ye didi nti se ye menstruate a yen kai de ye be wo hu ye na evolve no ya se no ye be wo hu ni ho ni yie na yen fa yen nsa ni nko hyem because ana me a me mfa me nsa nhye ho na emo me menstruate die pese me yi blood na nye wo na obe yi blood na nkasa be yi ne ho aba aha nti mama yen fa yen nsa nhye ya se da.
Thank you so much. Good menstrual hygiene no onye ni nyina ne de ye feel clean keke na emo oboy nso ma ye boye na apomuzen ho ban nkomozizi ye mu ye ka infection. What are some of the signs obema mehu de meribu mensaze but I de before for so abeka me menses na meri no. What are some signs that I will know I'm having infections?
That's it. Ebe free ade na wan sumpo ay mama nurse o se kanye mane maye pa ay e poncho ye kan infection a na ye beka de bi a mboa bi ana efi bi wa akọ baby onyi do okọ na oreho wa adwen nti no ye ka de nyema yen use wo yen ho no na ma odi infection ne ba me say be hu de infection no so aba ne de ebi menstruate no normally why as no onyi de orwew dem o onyi de why as no like you have cramps so much there pain no or intense ebi o ye nya some pain kakra or manageable or ye man ye ovulate mpo a ehu de etikakra either one side or the double side share there we betuma our twins so betuma
okay.
because this are 2x no or ba into tubes two ni or readjustment or chere very adwuma into kakra eya obi a yetum ye manage onu mpo ye ntumi manage mpo na so oye yi kakra na ye de hot water bottle o ye dru dem pain no ye dru ododo ye kakra aka na ye ntuma na eja ya fa ye fa bibi hot water bottle na ye bu nsu gum ye manage ne teta obi mpo na di bo nsu de do to show kakra na de to wa ya adna na we je na enunu mu nsu kakra warm drinks bibi ye wuti show kakra bi na enunu kakra na nsu show bi mpo a na ma eya na akofom but say ehu de eya no oye den echi de ntum kra na che de infection bi wo afei so no say a menstruate na me di kan ka de first start na odo oye red no ba me hu de flow no nse hu de echi no na menstruate fan na say menstruate a omba papa to dem order ba wan so enkoye bibia a wo che dem enkonum edru bia doctor aka cho de dem edru ide erifa ninti obeye dem a o che de no so infection bi aba echi so menstruate echi oba dodo oba ni pom echi no oye too much kakra na change hu ekra na hu asai omba to dem na oba echi wa ye dodo na echi so na menstruate onye dem echi oyi nkoto ahu de oyi nkoto wom nti ono clot ankese na yi ano so ono so ebe hu de bi wo a bibi akoche nti o de ekọ hospital wo enko drugstore na say chemical shop bi enko to eduru say wo hu ebi wo mpo a na ye growth bi in or ba no oye dem ana bibi nti awukọ doctor ne wo na nankasa on show no hu de o dem no orkodo afen so menstruate ebi hu de nimu no obon you can smell that unpleasant odor and I say bad odor bi wo ma ono so o chere de infection bi aba ho infection bi mu na no ye troka kakra no ye wa aboni mu aboni yi a pad na wanka sample ntumi ngina na afi hu de etim pampan no say menstruate yi ne hye ho no say ma change me ho bet meti mpampan no ono so on ya de papa e o de ni nyina ekọ hospital nti biara obeba wo menses bi menstruation so 5 days inde a menstruate 10 days a menstruate orukọ nti ono so infection sem ana a menstruate 5 days 7 days inde o ye 2 days 3 days na we jay no we ono so nya de papa nti biara be hu wo ahyase na menstruate yi no why divert it from that process now all different lane no then it means you need to come and see your clinician, you need to come and see your doctor.
Thank you very much. You know, currently reusable menstrual products are becoming very popular, and my question is, for those who use the reusable ones, how should they care for it? A combined na one father one care for menstrual products na yetim san use wo ye no biom
nti meka de May no mu no ye menstrual week celebration na ya fa May ni na for afia kwesimintim district health directory ya fa May ni na ye dai ye menstrual month nti ye ko schools na ye church won nti be we kwa teachers no so we ya do supporting na wa ba na wo the cloth ni bi because ye ko abani school ni mu kese like the public schools na ye ko ne kese because ye che parts na nkofo wa donate ni hu there less privilege no most of them we will find them there nti ye ko che part no so onyu su bi mpo a obetum wa so bi ahwe na no so meka there dignify we nya ne dignity na yesterday ye betum so ye use old cloth no And with the teachers no so what ma watch on how what be moldy be cloth ni be hands or no you reusable. Nti ono no ye catch one day won ho ne kama ebegwai na ayi no. Nti ono dey no said it to poly bag ni ma o cheche o de kofi o. Nti said kofi na ehun dey wa che wo bag ekoya first time e wo dey eyi hu wie hye wa type na akofa. Na the warm water no ensu ni mu wa dodo kakra. Na ahoro ni wom kama on na seminar. Ama na enyu atso kama wo det o dey betum. Let's say etumi nso nya det o so nya by force. Betum aye kama betumi the salt kakra. Na da egu nso hyiw nim. Na ahoro wa de kama ni seminar. Ewie a na awohrum. So you rinse it also very well. Ama enwu dey blood ni nyina afim. Then na wakwa dry. Under the sun. Let's dry it under the sun. Let it dry very well because we don't want it to be moist. Say adene ye moist ana nsu kakra wo ma ehun na o ma mboa no ha wonyinyini wom na ede kwhye ho nso na afi ne mboa no wankasa wo de mboa no bia ese wo de okye aboa na wo de na kwhye wase no nti wa na wo de akwhye ho na ono so beguro na owo ne mba na wakose infection ama wo. Nti ye ma ne dry bi mpo wa obenya ayon kakra na wato so wo anya ayon so asa awia ne boso ne mu ye hye na so wi na obobo ai no so enye bad na wakoko bobo ni nyina egu baby kama ai won so clean bobo ne kama ato wo egu betimi abobo na wa fe polythene bag na de gugu mu fine se na ohia na wasa akofa no we you see nti da bia na wo clean eno ye sanitary pad ana wo you see nti eno na ye reusable bet yen sanitary pad ankasa na owo market ne de ono user or disposable wo use ne one na wa to achene na wa fa foforo wo use ne one na wa to achene na wa fa foforo say your cloth ne de a ene de kwan ya echeche no wo de be fa so eno so eye so wo be use wo use ne ye na say wo clean ne fine eno so wo be use a unkonya infection bia.
But how about the menstrual cups? And also no a kwan ben so na ye be fa so a ye be care for you know.
Yeah, menstrual cups no na say no sheda hu bi wo market. It's as a cups no hu dey or accumulate oji moja no. Oji menstruational products no. Nti no nke wi a enko no so what two gu na one so clean in the same or the gu nso hyew nim. Na what the salt kakra gu ma na wo dey tola. Na no so we clean in the kama. Na wa drying under the sun. Nti be treating it today. Yen towels and the old cloth ye can wash them na no so why reusable my bet. These days we don't see the caps and the tampons because of the way it is. It's uncomfortable. It depends on the person using it. Like the tampon will go and stuck and be there, and then the thing will be so you go and remove the tampon and everything comes out like that. So if you are not comfortable with that, but some people, it depends on the preferences of individuals using the product. So leave it to them too.
Thank you so much. We are about to come to the end of today's episode. I hope you enjoyed our session as well. Please continue to send in your comments, your views, and they will be greatly acknowledged. So please, our last question for today's episode. Give us your last words for our dear ladies and then our dear girls who are now menstruating.
Okay, so our dear girls, especially the menstruation is normal. Menstruation is normal for girls and women. So for you to be a girl or a woman, you need to menstruate. So that when you come and we ask you your last menstrual period, you can be able to say something. This now, this. So if you don't menstruate, you will not be qualified to be a woman. Though we have people 1 in a million who they say do not menstruate, but they menstruate in a different way. They are all menstruation. Yes, so we ask you lots of questions and then you see that they are menstruating, but in a different way. So those ones are exceptions. But for you to be a woman, go through your normal reproductive system, you need to menstruate. You need to ovulate and menstruate. So it's normal. So they shouldn't take it like, I'm menstruating, I'm not going to school. I'm menstruating, I'm not going to work. I'm menstruating, I can't do this. You are menstruating and you can do everything, provided it's normal. If you have issues with your menstruation, talk to mommy or daddy. Talk to your brother, uncle. We need all the men involvement. We need the men to get involved and also help us to menstruate. We want to menstruate in dignity. We want to menstruate in dignity, like I said. You go to the schools, and then after giving the talk, the JHS girl, they will just approach you and say, Mommy, the menstruation, so it's normal. And I said, yes. Hey, my friend was telling me that when you menstruate, the blood will be coming, and you don't. Yes, they will tell you the truth, and they will also bring the falsehood one. Girls, when you menstruate, it means you are now a woman. So when you go have sex, you will get pregnant. That's what the most important things we tell them, that you will get pregnant. So you abstain from sex. And then women, when you want to, so I'm not saying that when you are menstruating, that you go and have sex, that you get pregnant. I'm saying that when you get to a stage that you start menstruating, it means that your reproductive organs have developed and has matured to an adult level, that when you go and have sex and you are ovulating, you will get pregnant. So you abstain from sex when you see your first menses. And then when you get to your menarche, you menstruate today, it will take a while before the next menstruation comes. So you don't have to worry. All I want to say is that menstruation is no big deal. You don't have to worry about it. You just need to practice menstrual hygiene, and you are good to go. It's good to menstruate. It's very proper for a lady to menstruate. So if you don't menstruate, you menstruate, and the following month you don't menstruate, you need to even be worried whether it will be a good worry or a bad one. So I'm not menstruating. Hey, am I pregnant? Then the one treating for infertility will be very happy. Hey, I'm not menstruating, I'm pregnant, thank God. And that little girl who is also playing corner rabbit and all those things will also get worried that she might be pregnant. So menstruation is normal. When you have issues with menstruation, don't feel shy to come to your healthcare practitioner to discuss. We'll help you to discuss it. We have STIs. So you are menstruating, you have challenges, meaning you could or you may have an STI, sexually transmitted infection. We can help you to manage your menstruation very well. You can go to a nearby clinic and then discuss with the nurses, the doctors, the pharmacists, all the health practitioners. We are there for you and we are ready for you. Thank you.
Thank you so much. It's been an awesome conversation, and I'm sure you enjoyed it as well. Thank you so much, Madam Comfort, for this valuable and insightful health information that you've given us. So please, as she has said it all, it is normal. So let's do well to practice all the safe menstrual hygiene tips that we've given you in order to save yourself and also improve your health and then your well-being. I'm still your host, Miss Nseidu, and we'll see you same time next week on Health Matters Podcast. Like, follow, share, and subscribe. See you on our next episode. Bye.